Non-small cell lung cancer, abbreviated as NSCLC, makes up roughly 80 to 85% of all lung cancers. When you have lung cancer, that means that certain cells in your lungs have become abnormal and are multiplying uncontrollably, forming what is known as a tumor. These cancer cells can also spread beyond the lung to tissues and organs throughout the body. Let's first look at a healthy pair of lungs. When you take a breath, air enters through your mouth or nose and goes into your lungs through the trachea, also known as the windpipe. The trachea divides into two tubes called the bronchi, where air enters your left and right lungs. The bronchi then divide to form smaller bronchi, which then divide to form smaller branches called bronchioles. At the end of the bronchioles are tiny air sacs called alveoli. Zooming in, your alveoli are surrounded by tiny blood vessels called capillaries that allow for gas exchange. Specifically, the alveoli absorb oxygen into your blood from the air that you inhale and removes carbon dioxide from the blood into the air that you exhale. This is the primary job of your lungs, taking in oxygen and getting rid of carbon dioxide. Your lung tissue and respiratory tract are bordered by several types of cells, known as epithelial cells. The types that we are most interested in include goblet cells, squamous cells, and large cells. Goblet cells are responsible for secreting mucin, which helps keep the lung moist and traps foreign invaders. Squamous cells are flat cells that help create the barrier between the airways and the rest of the body. Large cells are pretty much just that, large cells. These cells can appear throughout the lungs. Problems arise when environmental or genetic factors can cause these epithelial cells in your lungs to mutate. A mutation essentially means that the DNA of the cell has been damaged and causes the cell to behave very abnormally. A mutated cell becomes cancerous when the cell starts to divide uncontrollably. As these mutated cells begin accumulating, they begin to form what is known as a small tumor mass. As the cancer cells continue to accumulate, the cancers begin to push in on the airway. This restricts the airflow in the respiratory tract. These cancer cells can also break off from the primary tumor and enter nearby blood vessels and travel throughout the body to other organs and tissues, forming secondary cancers at these sites. This is referred to as metastasis. Let's now dive deeper into the risk factors that can cause our lung cells to mutate. Smoking is far and away the leading cause of lung cancer, and 80% of lung cancer deaths are attributed to smoking. Other environmental risk factors include radon and asbestos. Medical imaging, which includes X-rays and CT scans, are also a risk factor due to radiation potentially causing mutations in our DNA. In terms of genetics, unsurprisingly, genes that are the victims of mutation are the genes that control cell growth or the repair of damaged DNA. These genes include EGFR, ALK, ROS1, KRAS, and BRAF. The type of gene that is mutated can play an important role in potential treatments for lung cancer, as we will discuss in the various treatment option videos. There are three types of non-small cell lung cancer: adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. The types of NSCLC are defined by the type of epithelial cell in the lung that has become mutated. Adenocarcinomas affect goblet cells. Adenocarcinoma usually affects the outer part of the lungs. It is the most common type of NSCLC and comprises 40% of all lung cancer cases. Adenocarcinoma occurs mainly in current or former smokers. However, it is also the most common type of lung cancer seen in non-smokers. It is more common in women than in men, and is more likely to occur in younger people than any other type of lung cancer. Squamous cell carcinoma, as the name would suggest, affects squamous cells. Squamous cell carcinoma tends to affect the central part of the lungs, near the bronchus, the main airway. This type of cancer comprises 25 to 30% of all lung cancer cases. Squamous cell carcinoma has the strongest association to smoking, so those with a history of smoking are likely at a greater risk for this type of cancer. Large cell carcinoma affects our large cells and can appear in any part of the lung. Large cell carcinomas comprise roughly 10 to 15% of all lung cancer cases. Large cell carcinomas tend to grow quickly and have the highest tendency to spread throughout the body. The symptoms of non-small cell lung cancer vary and primarily depend on the size and location of the tumor. First, in response to the cancer cells in your body, your immune system launches a counterattack against these cells. This results in the release of cell signals that cause inflammation to help fight the invaders. This can cause symptoms such as fever and weight loss. If the tumor physically blocks your airway, this can cause symptoms such as a persistent cough, shortness of breath, and can eventually lead to pneumonia. If the tumor compresses nearby blood vessels, they can cause the backup of blood, which in turn can cause symptoms such as swelling, headaches, dizziness, and shortness of breath. Finally, if the cancer cells infiltrate the blood vessels, they can cause your mucus to become bloody, which then would lead to symptoms such as coughing up blood and blood-tinged phlegm.